Members, this bill creates a tug of war between the state and federal government, with our healthcare providers being the rope that is being pulled back and forth. They don't know how they're supposed to comply with these conflicting state and federal laws. It's not just me asking for this amendment. I was actually surprised to see that we had not carved out our healthcare providers in this legislation. I read last week in the Miami Herald that our healthcare providers were asking for this exemption because of how obvious of a conflict it is for them to be at risk of losing Medicaid and Medicare funding. So much so that even the CEO of the Florida Hospital Association, Mary Mayhew, reminded lawmakers that they're not going to jeopardize access for those who depend upon Medicare and Medicaid, saying that they would have no choice but to comply with the federal government, even if this state law passes, and they are not in compliance with state law. So members, our healthcare providers are asking for this. We should make sure that our most vulnerable are taken care of, that we don't put our healthcare providers in an impossible position of having to pick and choose, I guess, which law they're going to follow and which one they're going to break. Members, let's be rational about this. This is a good amendment. We need to support our healthcare providers, our safety net hospitals, and not put them in this impossible position for the sake of politics as usual in Tallahassee. Please vote for this amendment.
Members, Representative Smith, having closed on his amendment, all in favor of adoption of the amendment, say yay. Yay. All opposed, no. No. The noes have it. Seeing 5 hands, the clerk will unlock the machine and members will proceed to vote. Have all members voted? Have all members voted? Clerk will lock the machine and announce the vote.
40 yeas, 78 nays, Mr. Speaker.
Show the amendment fails. Read the next bill.